I'm guessing it's been a while since you've been on an airplane. Me too. But you remember that safety instruction from your flight attendant. Put your own oxygen mask on first before assisting others. Sound advice at 30,000 feet, but here on the ground, that approach is causing some turbulence. I'll explain. After record-breaking developments last year, not one, not two, but more than a dozen COVID-19 vaccines have been fully approved or currently in early use globally. Since last December, over 500 million shots have gone into arms. But when you dig down into those numbers, the rollout has been really, really uneven. The World Health Organization reports as of the end of March, 76% of those vaccinations have been given in just 10 countries. The United States and China are half that total. That leaves plenty of nations, unsurprisingly among the world's poorest, who have yet to distribute any vaccine at all. COVAX, the global initiative started last year by the World Health Organization and other partners, is pushing for equitable access to vaccines, trying to ensure it's not just the wealthy countries who get their shots. While plenty of dough has been pledged to COVAX, including $4 billion from the Biden administration alone, it's doses that are needed right away.
COVAX is ready to deliver, but we can't deliver vaccines we don't have.
Vaccine nationalism is that line from your flight attendant. Vaccinate your own population before donating supply abroad. So what's wrong with that? Well, first, there's the humanitarian angle. Many public health experts don't want to repeat mistakes made during the AIDS epidemic when low-income countries waited years for life-saving drugs that were readily available elsewhere. But there's a practical reason, too.
As long as there's outbreaks anywhere in the world, everywhere in the world is in danger.
As new mutations and variants of COVID spread around the world, scientists warn we're in a race to get shots in arms before the virus outsmarts the vaccines. The WHO and other global health organizations say leaders should be prioritizing vulnerable populations everywhere, healthcare workers, the elderly, and those with comorbidities, before giving vaccines to everyone else. That'll save a lot more people. Meanwhile, stockpiles in wealthy countries continue to grow. For example, the United States already has commitments to buy far more doses than it has people to inject.
If we have a surplus, we're going to share it with the rest of the world.